Living kidney donors can be family members, friends, neighbors, co-workers, or even altruistic strangers. This type of donation accounts for about 1/3 of all kidney transplants performed in the United States. To learn more about transplantation from a living donor's perspective, join us on the Roadmap for Kidney Transplantation, Part 2. There are two options for a person on the kidney transplant wait list: a transplant from a living donor or from a deceased donor. A living donor kidney transplant is when a kidney from a living donor is removed and placed into a recipient whose kidneys no longer function properly. Only one donated kidney is needed to replace two failed kidneys. If you have a compatible living donor, surgery can be scheduled after testing and evaluation is complete. In Ohio, the average wait time for a deceased donor kidney is 3 to 5 years. The timing is considerably shorter for a living donor kidney. If you pursue kidney transplantation as a treatment option, your transplant team will work with you to determine which option is right for you.
My family has a strong history of polycystic kidney disease. My grandfather passed away from PKD, and many of the other men in my family have unfortunately been plagued with kidney disease. I received a phone call from the wife of one of my family members. I knew that he had PKD, however, I didn't realize how severe it was until I got that phone call. The phone call was really just to ask me if I had a network as a nurse that I could put out the need for the kidney. In that same phone conversation, I learned that the family member was type O positive blood. Immediately I thought, I'm also type O positive blood. Why don't I get tested?
A kidney donor is generally 18 years of age and older, up to the age of 65. After the age of 65, most people will not have enough of their own kidney function to successfully donate. Certain health conditions may disqualify a person from donating, and this should be discussed with each center.
A living donor kidney transplant offers many advantages for people with kidney disease. Wait times are reduced from years to months. There is less time spent on a wait list, which could prevent possible complications and deterioration of health. Overall outcomes are better. There are better short and long-term survival rates. Kidneys begin working faster. Because the transplanted organ comes from a healthy living person, the recipient's time spent recovering from a kidney transplant is often shorter. Potential avoidance of dialysis if it has not been initiated, and donors and recipients can plan the surgery for a time that's convenient for them. This eliminates the rush and unknowns tied to being on the transplant wait list. As with any surgical procedure, there are also risks, both for the donor and recipient. Living kidney donors go through extensive testing to ensure they are in the best health to undergo a major surgery, and that the donation process will not harm their health in any way. The transplant team will carefully outline and discuss all the potential risks of the transplant.
The process to be a kidney donor is very thorough. I started the process in March of 2021 and was able to donate June 7th of 2021. So just a few months, but in that few months there was classes that I received, there was counseling that I received, many tests, blood work, CAT scans, ultrasounds, to make sure that I was healthy enough to donate my kidney. The living donor classes taught me a variety of aspects of the donation process. We talked about the financial aspect. Would I be affected financially or be out of work because of donation? If so, there were grants available and there were tax credits available for those. We also talked about the physical piece.
Kidney donors are supported very heavily during the evaluation process and afterwards to ensure they have an optimal outcome.
Both you and the living kidney donor will be thoroughly evaluated to determine if the donor's organ is a good match for you. There are 3 main tests that determine if you and the donor are compatible: blood typing, tissue typing, and cross-matching. If your living kidney donor isn't a compatible match, your transplant team may offer you and your donor the opportunity to participate in a paired kidney exchange, also known as a kidney swap.
When considering living donation, There is a program through the National Kidney Registry to help arrange swaps. If a donor is not a match for the person they want to donate to, they may be a match for someone else. And that person may have a donor who is not a match for them. And in that case, a possible kidney swap can occur.
If your donor successfully completes a medical, surgical, and psychosocial evaluation, he or she can undergo the removal of one kidney. The vast majority of transplant centers in Ohio use laparoscopic surgery for the kidney removal. This form of surgery, performed under general anesthesia, uses very small incisions, a thin scope with a camera to view inside of the body, and specialized instruments to remove the kidney. Compared with the large incision operation used in the past, laparoscopic surgery has greatly improved the donor's recovery process in several ways. Decreased need for strong pain medications, shorter recovery time in the hospital, quicker return to normal activities, and very low complication rate. The operation takes on average between 2 and 3 hours. Usually the recipient and donor surgeries happen at the same time in separate operating rooms. Recovery time in the hospital is typically 1 to 3 days. Donors are often able to resume normal activities as soon as 2 to 3 weeks after the procedure.
After surgery, the pain was minor. I was, of course, a little bit sore, just like you would be from any surgery, but that was taken care of with Tylenol alone. As far as the fatigue went, I was tired, but about 4 weeks after surgery, I felt like a switch had flipped and my energy came back and I felt back to normal. As far as my life goes, my life has gone back to completely normal, and the impact I have made on my family member is one that I can't measure. Immediately, he started making urine. His creatinine level was normalized. He now has gone back to his follow-up appointment almost 1 year later, and his lab work is perfect. He's got a normal functioning kidney. And his wife has explained to me that the sparkle is back in his eye.
A kidney transplant provides benefits not only to the recipient, but the donor as well. Positive emotional experience. This includes feeling good about improving another person's life. More time with loved one. By donating a kidney, you and the donor are gifted more quality time together and greater understanding of health or health conditions. The extensive medical testing during the evaluation can provide the donor with a comprehensive picture of his or her physical health.
Part of my decision to become a living donor was prioritizing the needs of somebody else above my own. When I think about it, I think about if I had 2 loaves of bread and the person next to me is starving. Am I going to let them starve? Of course I'm not. I'm going to give them one of my loaves of bread.
If you or a loved one has questions about any of the information we shared, talk to your nephrologist or contact the Kidney Foundation of Ohio. Continue this journey by viewing the Roadmap for Kidney Transplantation, Part 3.